Hi, my name is Christine, and I am going to do my demonstration for my PO, sub-Q, and intramuscular administration. So I have Miss Millie's MAR, Miss Millie Larson, January 1st, 1936. I have 3 medications: Halperdol, which is Haldol, and there is an order for a 2 milligram IM, Lispro, 10 units sub-Q, and Docusate, 100 milligram tablet. Okay, so I have Halperdol, which is 2 milligrams intramuscular to give now for control of agitation. This is 5 milligrams /ml, 1 ml vial. And it is 7/20/31 is the expiration date. I did do calculations, and it is actually, the order is to give 0.4 milligrams. And this you would give with a 1-inch injection needle, IM injection. So once again, this is for Millie Larson, who has no allergies, and this would be a 0.4 Halperdol, 5 mg/ml. Expiration is good. This is insulin, and this is Lispro Humalog, 10 mLs, 100 units per ml. The order is for insulin, Lispro, 10 units subcutaneous with breakfast. Her blood sugar would have been checked prior to giving this. And this you give with the insulin syringe. So I also did calculations for this as well, and this would be a 0.1 in an insulin syringe. And so Lispro, 10 units sub-Q, expiration 4/20/31. That is also within range. Docusate. This is a 100 milligram tablet. The order is for Docusate, 100 milligram tablet oral to give now to soften stools. So we'll start with the oral. We only need 1 tablet. Docusate, 100 milligram tablet oral, Millie Larson, 1/1/1936. Expiration date is good. That would be the first and second check. And then practice hand hygiene again. Some gloves. Get my insulin syringe. Get an alcohol pad, clean off the top of the insulin. And then this is the Lispro, 10 units, which we said is 0.1. So I'll clean off the top of this. Get rid of my garbage. We're going to draw back 0.1. It's kind of hard to see because of the top. And draw back 0.1 of air. And then you're going to do the swoop technique to get the top back on and close and label. And you're going to label Liz Pro, 10 units, Millie Larson. My label's a little bit. Okay, so get all that prepared for the patient. Get the next one, secure that medication. The next medication is the Halperdol, which is the 2 milligrams, which we discussed, which was the 0.4. Now clean that off. And get rid of that garbage. And get my syringe with my 1-inch needle. I did not have a 1-inch in my kit, so we're going to pretend that this is a 1-inch. It's actually a 5/8, but once again, like I said, we're going to pretend for demonstration purposes. We're going to draw back 0.4 of air. And you're going to do the swoop technique. Sorry, my swoop was off the table. And you're also going to label that. And that is Halperdol. Two milligrams. Miss Millie Larson. All my garbage together. I'm going to go in the room and verify that I have the correct patient and the 2 patient identifiers. Hi, Miss Millie. My name is Christine. I'm here with some medications for you. Hi. Millie Larson. Millie Larson. Date of birth, 1/1/1936. 1/1/1936. Can I verify your ID bracelet? Millie Larson. 1/1/1936. Yes. No known allergies? No known allergies? Okay. And your blood sugar was checked this morning? And you have no roommate? So your privacy is not an issue, and you're secure in your bed, and you are covered. Okay, and no pain. And your blood sugar was already checked this morning. Okay, so I have 3 medications for you. You have an oral medication, you have a sub-Q medication, and you have an IM medication. So I'll start off with your oral medication. You have some juice from before you have your breakfast. You have your juice because your breakfast tray is coming. Okay, so you have an order for your DocuSate, which is a 100 milligram tablet. This is to help to soften your stools. Okay. DocuSate 100 milligram tablet. It's 1 pill, Millie, and you can have that. You have your apple juice there. It's gonna your breakfast tray is coming. Okay, there you go. Thank you, Miss Millie. Okay, next is going to be your sub-Q, and this is your Lizenpro, and this helps you with your blood sugar. You have an order for 10 units, which is 0.1, and it's going to go in your abdomen. Okay, get some gloves on here. So I'm just going to clean off your belly with an alcohol pad, and I'm going to go 2 finger widths right underneath your belly button. Okay. Clean off your belly button here. Underneath your belly button, 2 finger widths. I'm going to allow that to dry. Okay. I'm going to pinch your adipose tissue here. Pull this off. I'm going to go in at a 45-degree angle. Put that in. Cover. Pull the safety. Get rid of the needle. Take the top. Cover. You're not bleeding. Would you prefer a Band-Aid? You don't need a Band-Aid? There's no blood. Yeah, you've gotten that done so many times it doesn't even bleed anymore. I know you're used to it, right, Millie? Okay. No, yeah, there's no blood. No Band-Aid? Okay. All right, perfect. All right, I'm gonna get your other medication ready, Miss Millie. Okay, and that is the Helpridol. It's Haldol, 2 milligrams, and that's an IM injection. This is to control your agitation. Okay, and if you can go up on your left hip, I can give it to you in your right thigh. Okay. I'm gonna put my hand on your right hip and your right knee. I'm gonna clean off the area in between. Okay. I'm gonna spread the skin. Okay, and I'm gonna go right in between. Slowly inject, cover, engage, get rid of the needle. I'm gonna get this. This is not an alcohol pad. It is just a small gauze pad. I know it looks like an alcohol pad. Just gonna cover that and get a Band-Aid. Keep applying pressure. Peek. Okay. I'll put a Band-Aid on. How are you feeling, Miss Millie? You're feeling good? Any pain? Any discomfort? You're okay? All right. I'm going to maintain your privacy. I'm going to give you your call bell, and I will see you later in a few hours. Now I'm going to document. All right. Take care, Miss Millie. Take off my gloves, and I will sanitize, and I will document, and I will end the video. Thank you.